Right now, I want you to pay very close attention, because what I'm about to tell you could be the difference between catching a silent warning in your body or missing it entirely. In the next few minutes, you may realize your body has been giving you signals that most people ignore until it's too late. And I don't say that to scare you. I say it as a doctor who has seen too many preventable emergencies unfold from symptoms people brushed aside. Before we go deeper, take a second to like this video and subscribe to the channel. It helps more people receive this kind of important health awareness in time, and it tells me you want more honest, doctor-led guidance like this. Now let me ask you something personal. Have you ever suddenly felt a strange weakness on one side of your body? Or noticed your speech becoming slightly unclear for a few seconds, then everything went back to normal? Many people dismiss it. They say, "I was just tired," or "maybe I stood up too fast." But what if I told you that could be one of the earliest signs your brain is under temporary stress? What I'm about to share is especially important for adults over 35, and even more critical if you are over 50. Because there is a condition called a transient ischemic attack, or TIA, often referred to as a mini-stroke. And unlike a full stroke, the symptoms disappear quickly, which is exactly why it is so dangerous. Most people don't realize that a TIA is often the body's final warning before a major stroke. It's like a smoke alarm going off briefly and then stopping. You might think everything is fine, but inside, something serious may already be developing. I've seen patients ignore these early signs because they lasted only a few minutes. They went to sleep thinking nothing serious had happened, but days or weeks later, they returned with something far more severe. And here is what makes this even more concerning. TIAs often don't cause pain. There is no dramatic warning. Just subtle, confusing changes, vision blurring for a moment, slight dizziness, numbness in the hand, or trouble finding the right words. So as we continue, I want you to gently reflect on your own experiences, not with fear, but with awareness, because understanding these signs early can help you take steps that may protect your brain health in the long run. Now, let's go deeper into what your body might already be trying to tell you, even if you've been overlooking it. One of the most commonly ignored warning signs of a mini-stroke is sudden numbness or weakness, especially on one side of the face, arm, or leg. It might last only a few seconds or minutes and then disappear completely. That is exactly why people dismiss it. They assume it was just a pinched nerve or poor posture. But medically speaking, even brief episodes like this can indicate that blood flow to a part of the brain was temporarily reduced. Your brain depends on a constant supply of oxygen and nutrients. When that supply is interrupted, even for a short time, it can create these subtle neurological disturbances. I've had patients describe it as, "My arm just felt strange for a moment," or "My face felt slightly uneven when I smiled, but then it went back to normal." These are not random occurrences. They are signals that should never be ignored. Another sign is sudden difficulty speaking or understanding words. You might be in the middle of a conversation and suddenly struggle to find the right word, or your speech may sound slightly slurred. Sometimes the person listening notices it more than you do. What makes this so tricky is the temporary nature of the episode. Because everything returns to normal quickly, people convince themselves it wasn't serious. But in reality, the brain may have experienced a brief interruption in blood flow. Most people don't realize that these episodes can happen days, weeks, or even months before a major stroke. The body often gives multiple warnings. It's just that we don't always recognize them. There is also a visual symptom that many overlook. A sudden loss of vision in one eye, or a dark, curtain-like shadow passing over your sight for a short time. Even if it clears up quickly, it should never be ignored. It is a strong indicator that something is affecting the blood vessels supplying the brain or eyes. I want you to think carefully here. Not to panic, but to observe. Because awareness changes outcomes. And in my experience, the people who recover best from serious neurological events are often the ones who recognized the early subtle signs. So now that you understand these initial symptoms, let's move into some of the less obvious warning signs that most people never connect to brain health at all. There is a particular symptom I want you to take very seriously because it is often mistaken for simple fatigue or stress. It's sudden dizziness or loss of balance. You might feel unsteady while walking or like the room is slightly spinning for no clear reason. Many people blame low blood pressure, dehydration, or just getting older. But when this happens suddenly and without explanation, especially alongside other subtle changes, it can be a warning sign that the brain is not receiving consistent blood flow. I've seen patients describe it as, "I just felt off for a moment," or "I had to hold on to the wall, but it passed quickly." That quick recovery is exactly what makes it so dangerous, because it removes the urgency in the person's mind. Another overlooked sign is a sudden, severe headache that feels different from your usual headaches. Not every headache is a warning sign, of course. But if it comes on suddenly and feels unusual, especially if it's combined with confusion, vision changes, or weakness, it should be evaluated carefully. Most people don't realize that the brain rarely gives isolated signals. It often sends a combination of subtle symptoms that together form a pattern. The problem is, we tend to look at each symptom separately instead of connecting them. There is also something called temporary confusion or cognitive fog. You may find yourself pausing in the middle of a sentence, forgetting what you were about to say, or feeling briefly disoriented in familiar places. These moments can be brief, but they matter. I remember a patient telling me, "I knew something was wrong for a few minutes, but then I felt fine, so I didn't think it was important." That is a sentence I have heard too often in clinical practice. The truth is, the brain is incredibly resilient, but it is also very sensitive to changes in blood flow. Even short interruptions can create symptoms that disappear quickly but still carry important meaning. So if you've ever experienced these brief, unexplained episodes, I want you to take them seriously, not with fear, but with responsibility toward your health. And now, let's explore the warning signs that most people completely miss because they don't seem neurological at all. One of the most surprising warning signs of a mini stroke is a sudden change in coordination. You might notice you're dropping objects more often, or your handwriting suddenly looks different for a short period of time. At first glance, this doesn't seem serious. People often say, "I was just tired," or "I wasn't paying attention." But when coordination changes happen abruptly, it can indicate that the brain's communication pathways were temporarily disrupted. Another subtle sign is difficulty swallowing or a strange sensation when trying to eat or drink. This can feel mild, like food is not moving as smoothly as usual. Because it often resolves quickly, people rarely connect it to anything serious. There are also emotional or behavioral changes that can occur. Some individuals experience sudden irritability, confusion, or a brief sense of detachment from their surroundings. These are not psychological issues alone. They can sometimes reflect temporary neurological changes. Most people don't realize that the brain controls far more than movement and speech. It also regulates balance, coordination, sensation, and even aspects of emotional processing. That is why TIA symptoms can feel so varied and confusing. I've seen cases where a person only realized something serious had happened after multiple small episodes over time. Each episode was brief, so they never connected them together. But when viewed as a pattern, they told a very important story. Another key point I want you to understand is timing. These symptoms often last only a few minutes, sometimes less than 5. And because they disappear, people assume the danger has passed. But medically, the risk period may still be active. This is why I always encourage awareness of repetition. One episode might be easy to dismiss, but repeated episodes, even if mild, deserve attention. Your body is constantly communicating with you. The challenge is learning to recognize when those signals are meaningful versus when they are not. And with conditions like TIA, it is always better to err on the side of caution. Now, let's move into the final set of warning signs that can appear right before a more serious neurological event. There is a symptom that many people describe but rarely connect to anything serious, a sudden feeling that something is wrong, even if they can't explain it. This sense of internal imbalance can sometimes appear just before or during a transient ischemic episode. It may feel like confusion mixed with anxiety, or a brief inability to focus on what is happening around you. Some people describe it as a disconnect from their environment. While this can have many causes, when it appears suddenly and alongside physical symptoms, it becomes more significant. Another important warning sign is sudden changes in vision that are not just blurriness, but partial loss of vision or double vision. Even if it lasts only a minute or two, it should not be ignored. Vision changes are often closely linked to blood flow in the brain. There is also an often overlooked symptom involving facial changes. A slight drooping on one side of the face, or difficulty smiling evenly, even if temporary, can indicate neurological involvement. These changes may be so subtle that only a mirror or someone else would notice. I want to emphasize something very important here. Not every episode means something severe is about to happen, but TIAs are known as warning events because they signal increased risk in the near future. That is why early recognition matters so much. Most people don't realize that acting early can significantly change outcomes. Seeking medical evaluation after these symptoms can help identify underlying issues such as blood pressure irregularities, cholesterol buildup, or circulation problems. These are not conditions you can always feel developing. They progress quietly over time. The TIA, in many cases, is the first visible signal. I've had patients tell me, "I wish I had known earlier that these small episodes mattered." That regret is something I hope fewer people have to experience. So if anything you've heard so far feels familiar, even slightly, it is worth paying attention, not to create fear, but to create clarity. Now, let's talk about what you can actually do when these warning signs appear and how to respond in a calm, informed way. If you ever experience symptoms that resemble a mini-stroke, the most important thing is not to ignore them, even if they disappear quickly. Time matters more than people realize because these episodes can be a signal that the brain's blood vessels are under stress. The first step is simple but crucial. Take note of the time the symptoms began and how long they lasted. This information can be extremely valuable for healthcare professionals in understanding what happened. Many people hesitate to seek help because the symptoms are gone by the time they consider it. But from a medical perspective, the event itself is still important, even after recovery. I always advise patients to treat sudden neurological changes as meaningful until proven otherwise. It does not mean you should panic. It means you should observe and respond appropriately. Another important aspect is identifying patterns in your health. For example, if you have high blood pressure, diabetes, or a history of smoking, your risk may be higher. But even without these factors, TIAs can still occur. Most people don't realize that prevention often starts with awareness. Simple lifestyle adjustments like maintaining stable blood pressure, staying hydrated, managing stress, and following regular checkups can support long-term brain health. It is also important to communicate these episodes to your doctor clearly, even if they seem minor. Describing exactly what you felt, how long it lasted, and any associated symptoms helps build a clearer picture. I've seen many cases where early reporting led to further testing that revealed underlying issues before a major event occurred. That is the power of early attention. And I want to say this gently but clearly. Your body rarely sends meaningless signals. Even brief symptoms deserve respect and attention. Now, as we move toward the final part of this discussion, let's focus on what these warnings mean for your long-term health and how you can protect yourself going forward. When we step back and look at all these symptoms together, a clear message emerges. Your brain often gives warning signs before a serious event, but they are usually subtle, brief, and easy to dismiss. The challenge is not that the body stays silent. It is that the signals are easy to overlook in a busy, stressful life. That is why education and awareness are so important, especially as we age. Most people don't realize that conditions affecting the brain and blood vessels often develop slowly over time. A transient ischemic attack can be one of the earliest visible indicators that something needs attention. But here is the reassuring part. Awareness gives you power. When you recognize these signs early, you have the opportunity to seek care, make changes, and potentially reduce your risk of future complications. I've worked with many individuals who only understood the importance of these symptoms after experiencing them. And almost all of them say the same thing afterward. They wish they had taken those early signs more seriously. That is why I encourage you to treat your body with curiosity rather than fear. Notice changes, pay attention to patterns, and never hesitate to seek medical advice when something feels unusual, even if it seems minor. Your health is not just about reacting to illness. It is about understanding your body's language before problems become severe. If this video helped you understand something new today, make sure you are subscribed so you don't miss future guidance that could support your long-term well-being. And if someone you care about is in the age group where these symptoms matter most, consider sharing this with them. Because sometimes the most important health information is not dramatic. It is subtle, quiet, and easy to miss. And recognizing it in time can make all the difference.